present on the iliac crest. Okay, there's the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. This is greater sciatic notch. Yes, you can put your microphone on mute, please. Yes. Okay, so just look at this greater sciatic notch. Inferior gluteal line is traveling from greater sciatic notch up to anterior inferior iliac spine. Anterior gluteal line is from greater sciatic notch up to the ventral segment of iliac crest. Okay, on ventral segment of iliac crest, there is a tubercle in this region, which will be called the iliac tubercle. So anterior gluteal line travels up to the iliac tubercle, whereas this posterior gluteal line will be traveling up to the dorsal segment of iliac crest. So the importance of lines is that okay. Just 1 minute. Yes. This gluteal lines help to divide the gluteal surface of the ilium, which will give origin to the different gluteal muscles. So we are going to look at only the posterior gluteal line, and posterior to it, the gluteal surface of the ilium gives origin to gluteus maximus muscle. The gluteus maximus also takes origin from a fascia here. You can see this is called the lumbodorsal, or it's the fascia covering the erector spinae muscle. I'll just show you another diagram to understand the origin. Okay, so from the origin is from gluteal surface of the ilium, from the dorsal segment of iliac crest, dorsal surface of sacrum and coccyx, from sacrotuberous ligament. And the insertion, 3/4 of the fibers will get inserted into iliotibial tract, which we had discussed in the previous class. And 1/4 of fibers of gluteus maximus gets inserted into gluteal tuberosity of the femur. So what is the shape of the gluteus maximus muscle that you see here? Simple question. What do you think is the shape of gluteus maximus muscle? Yes, quadrilateral or rhomboidal shape. So when you are doing the dissection or in the specimen, you will be able to identify gluteus maximus muscle easily. But just look above gluteus maximus, there is a fascia, which is called the gluteal fascia or gluteal aponeurosis. And deep to this fascia, there will be the gluteus medius muscle, which is present. I'll show you that in the further slides. Okay, so here in this diagram, the gluteal aponeurosis, okay, when it is removed, you can see the muscle fibers of gluteus medius. So this is the anatomical position. So can you tell me what is the nerve supply of gluteus maximus? What is its nerve supply? Yes, anyone knows? You can type the answer in the chat. Okay. Yes, the nerve supply is the inferior gluteal nerve. And if possible, you can learn the root value as well. Inferior gluteal nerve, it's a branch which arises from the lumbar plexus. What is the action of gluteus maximus? You know it is a large muscle and it is a very powerful muscle. So what would be the action? Yes, when you say extension, you should mention extension of what? Yes, good. It is the chief extensor of the hip joint. Good. And it also helps to extend the trunk over the hip joint. For example, when you are standing up from sitting position to give stability to the trunk for extension. Gluteus maximus is the muscle that acts. So I just want to show you this diagram to show the center of gravity of the body, which is seen in dotted lines. Okay, so center of gravity, it passes behind the hip joint and in front of the knee joint. So because of this, that center of gravity passes behind the hip joint, there is a tendency for the trunk to be displaced backwards in standing position. So in order to prevent that displacement, or in order to help us stand erect, there are certain stabilizing factors in the body. So anteriorly, there's an important ligament for the hip joint called the iliofemoral ligament. This is the strongest ligament in the human body. So it helps to prevent the backward displacement of trunk over the hip joint. Gluteus maximus muscle also helps to stabilize the trunk and hip joint. And we had learned last class that iliotibial tract helps to stabilize the knee joint because center of gravity is passing anterior to the knee joint. Ligaments of the knee also help. So this is just an additional point of interest. Okay, but the most important feature that you need to know is that gluteus maximus helps in stabilization of the trunk, and iliofemoral ligament, which is the strongest ligament of the hip joint, helps to prevent the backward displacement of trunk over the hip. Okay, so now this topic is highly important. Okay, it's asked in your theory exam and also for your discussion viva. Structures under cover of gluteus maximus. The theory class will be taken later, but today I would like to focus on what are the muscles which are present deep to the gluteus maximus. So you have this diagram in your textbook. You have to learn this diagram by heart. Okay, so I'll just tell you this outline is gluteus maximus, and here the gluteus maximus is reflected. So this muscle that you see, okay, this is gluteus medius. And inferior to it, you see the muscle called piriformis. This is a very important muscle. Okay, how will you identify piriformis? Is, see, you see a large nerve in the gluteal region, which is the sciatic nerve. Okay, so have this in your mind. This large nerve in the gluteal region is the sciatic nerve. And sciatic nerve emerges into the gluteal region inferior to the inferior border of piriformis. So when you have the dissection specimen with you, if you trace the sciatic nerve, the muscle below which the sciatic nerve enters into the gluteal region is the piriformis muscle. Okay, now inferior to piriformis, there are three structures which are fused together. Okay, that is called the gemelli and the tendon of obturator internus. Okay, so the word gemellus, it is derived from the word Gemini. What is the meaning of the word Gemini? I think you already know that. Yes? Anyone? What's the meaning of the word Gemini? Yes, it means twin. Good. So the muscle gemellus is named so because it is paired. Okay, there is the muscle present superiorly is superior gemellus, and the muscle which is present inferiorly is the inferior gemellus. And together with the tendon of obturator internus, this whole structure is called the tricipital tendon. Inferior to the gemelli, this muscle is the quadratus femoris. And this bony landmark here, okay, this is the ischial tuberosity. So you can get the orientation of the bony structures. Okay, this is ischial tuberosity. From ischial tuberosity, there is origin of muscles of posterior compartment of thigh, which is called the hamstring muscles. Okay, so please learn this diagram, then you'll be able to learn this topic easily. Once you know this diagram, all the structures are present here. And also look here, medial most, this ligament between the sacrum and the ischial tuberosity. This is called the sacrotuberous ligament. So can you see, related to sacrotuberous ligament, there are three structures. Okay, this is called as an acronym, we call it the pin structures, or that is pudendal nerve and the internal pudendal artery and nerve to obturator internus. So these pin structures will be medial most in the gluteal region. We'll see how that is. One more nerve I want you to learn is this nerve, which is medial to the sciatic nerve. This is called the posterior cutaneous nerve of thigh, or it's also known as the posterior femoral cutaneous nerve. Okay, so next question that you need to know is, what are the short lateral rotators of the hip, or it's also called short lateral rotators of the thigh? Yeah, out of all these muscles that I mentioned, a group of them is known as short lateral rotators of the hip. So can you tell me which are the muscles which are called the short lateral rotators? You can type it. Okay. Anyone with other answers? Yes, piriformis is one of the short lateral rotators. Yes, good. From piriformis up to quadratus femoris, the piriformis, the gemelli, and quadratus femoris together, all of this group of muscles is known as the short lateral rotators of the hip. Piriformis up to quadratus femoris. So please remember that sometimes a short note can be asked as short lateral rotators of the hip. So at that time, you need to know the names of these muscles and the details about each of these muscles. Okay, so this is just to show you the sacrotuberous ligament. And in the hip bone, this is the greater sciatic foramen. And this is the lesser sciatic foramen. Okay, so this region here is called the ischial spine. Okay, and you have to imagine deep to the greater sciatic foramen. Okay, inside the pelvic cavity is present. The pelvic cavity is present inside here. So these pin structures that I mentioned before, the pudendal nerve, the internal pudendal artery, and the nerve to obturator internus, they leave the pelvic cavity, they cross the ischial spine, and again, they will enter into the lesser sciatic foramen. So it's a short curved course of the pin structures in the gluteal region. So this is just to show you how the internal pudendal artery is curving over the ischial spine. So this is also a frequently asked question. What are the structures related to the ischial spine in the gluteal region? And how do these structures travel from the pelvic cavity to the gluteal region? So please remember the name of these three structures. So this is the dissected specimen to show the piriformis muscle. And I told you, you can identify the piriformis if you trace the sciatic nerve. Okay, this thick nerve here is the sciatic nerve, and it is emerging from lower border of piriformis muscle. And you can also see there are other nerves in the gluteal region called the inferior gluteal nerve and superior gluteal nerve, accompanied by their corresponding vessels. So piriformis muscle is called the key muscle of the gluteal region. So the question is, why is piriformis named as key muscle of gluteal region? Does anyone know the answer? Okay. So please learn this, that piriformis is the key muscle, and sometimes the examiners would ask why. So does anyone know the answer? I'll just wait for a minute. Okay. So the answer is that the other structures, okay, the nerves and the blood vessels in the gluteal region. Yes, okay. Good attempt. Okay. Any other answer? Okay, the answer is that, okay, the nerves and vessels of the gluteal region, they are named in relation to the piriformis. Okay, for example, here, the inferior gluteal vessels and nerve, they emerge into the gluteal region from inferior border of piriformis. So that's why it is named as inferior gluteal nerve. Whereas the vessels and nerves which emerge from the superior border of piriformis, they'll be named as the superior gluteal nerve and vessels. So that is why we call piriformis muscle as the key muscle. So please remember that, okay, even in head and neck or other regions of the body, you will be learning certain key structures. So they are named so because the other structures in that region will also be named in relation to this key structure. That's the key structure anatomy. And here in this diagram, you can also see the posterior femoral cutaneous nerve, also known as posterior cutaneous nerve of thigh. It is medial to the sciatic nerve. So though this word is cutaneous nerve, it is a deep structure for most of its course. It is a branch from lumbar plexus, and it will become cutaneous only in its further course in the leg. So that's a special feature of posterior femoral cutaneous nerve. Okay, so this is the dissected specimen in which gluteus maximus muscle is reflected. So you can see deep to it, this is the gluteus medius muscle. And then when we identify the sciatic nerve and you trace it upwards, you can see sciatic nerve is emerging from the lower border of a muscle here. So this muscle is piriformis, it's labeled with P, that is piriformis. Can you identify what is the structure that is labeled as 1? Okay, which muscle is it? Inferior to piriformis, what is the next muscle that comes in? Can you identify what are the muscles that are labeled as 1 and 2? You can type the answer. Yes. 1 is superior gemellus. Okay. So 1 is superior gemellus. 2 is inferior gemellus. And if you look closely between 1 and 2, there is a white tendon that is present. So that tendon is tendon of obturator internus. So in your exam also, when you get the specimen, first identify sciatic nerve, trace it to identify the piriformis. Inferior to the piriformis, you look for 2 muscle fascicles with a white tendon in between. That will be the gemelli with the tendon of obturator internus. And inferior to the inferior gemellus, okay, this muscle, this is the quadratus femoris. Now, can you identify what are these structures, which is labeled as 3? Okay, this is the gluteal region of the left side. So this is the medial aspect. Yes, what is labeled as 3? They are the pin structures. Okay, so right now, yes, in class, we are mentioning as pin structures, but please remember for your exam, don't say it as pin structures. Okay, it's just an acronym. You have to specify it is the pudendal nerve, internal pudendal vessels, and nerve 2, obturator internus. Okay, now labeled as H over here. Okay, in the specimen, you can feel this region. You can feel the bony prominence of ischial tuberosity. So this is actually the origin of the hamstring muscles. And in this region, you can palpate the trochanter of the femur in the specimen. Okay, now we have reflected the gluteus maximus and the gluteus medius muscle also. Okay, so this incision on the gluteus medius muscle, and we're reflecting gluteus medius. So deep to gluteus medius, you see muscle fibers. This is gluteus minimus. Okay, you can compare this diagram in your atlas. That is, deeper to gluteus medius will be gluteus minimus. And the vessels and nerves which are present on the surface of gluteus minimus, okay, that is superior gluteal vessels and superior gluteal nerve. Okay, so the branches that you see on top of the gluteus minimus muscle is superior gluteal vessels and nerves. Keep that in mind. Okay. So this is the key muscle of gluteal region, which is the piriformis. So now you need to know what are the attachments of piriformis. So can anyone tell me the origin of piriformis muscle based on this diagram? Okay, where is the piriformis muscle taking origin from? Yes, you can type the answer in the chat. Origin of piriformis muscle. Yes, piriformis muscle takes origin from pelvic surface of the sacrum. Good. What about the insertion of piriformis? It's seen in this figure, insertion of piriformis. Yes, very important. Yes, tip of greater trochanter or the apex of greater trochanter. Yes. So you have to mention specifically which point on the greater trochanter. So let's look at the origin. So this is the sacrum, pelvic surface of sacrum. Okay, so this red color structure is the origin of piriformis. So the shape of origin of piriformis, it is said to be an E shape, okay, shape like the alphabet E, from pelvic surface of sacrum, whereas insertion is into the tip of greater trochanter of the femur. Okay, so now next muscle we'll be looking at is the obturator internus. Okay, in the gluteal region you see only tendon of obturator internus, whereas here the entire muscle belly of obturator internus is exposed. So where does obturator internus muscle take origin from? These muscles are spotter questions also for you apart from discussion topic. So that's why you need to know the details of these muscles. So obturator internus muscle, where does it take origin from? Yes, good. From the pelvic surface of obturator membrane. Very good. It's quite easy to remember. If you know the hip bone, this is the pelvic surface. Okay. This is the obturator foramen. It will be covered with obturator membrane. So from the area or adjoining the obturator membrane, there will be the origin of obturator internus muscle. What about the insertion of obturator internus? Yes, it's given in this diagram. Insertion of obturator internus muscle. Yes, medial surface of greater trochanter. Okay, so now you need to know a landmark. Suppose this is the greater trochanter of the femur, and this is the medial surface. Okay, there will be a fossa called trochanteric fossa. There is a depression on medial surface of greater trochanter called trochanteric fossa. So obturator internus muscle is inserted superior to the trochanteric fossa. Okay, so remember that point. Sometimes students get this wrong in the exam. Okay, there is the trochanteric fossa on medial surface of greater trochanter, but that is not for insertion of obturator internus. Obturator internus and the gemelli, they get inserted superior to the trochanteric fossa. So please remember that point. Then the tricipital tendon, or another name is triceps coxae, that refers to obturator internus and the gemelli together. Whereas the trochanteric fossa is for insertion of another muscle called obturator externus. So keep that in mind. What about the origin of the superior and inferior gemelli? Yes, superior gemellus and inferior gemellus. Where does it originate from? It's given in this diagram. You can type the answer. Yes, superior gemellus is originating from the ischial spine, and inferior gemellus will be originating from the ischium in relation to the lesser sciatic notch. Okay, good. So yes, ischial spine, like I said, the structures related to it are important, the pin structures. Apart from that, the origin of the superior gemellus as well. Good. Okay, so which muscle gets inserted into quadrate tubercle of femur? Okay, this is the posterior view of the upper end of femur. Okay, this is the greater trochanter and lesser trochanter. In between the two, there is an intertrochanteric ridge. Yes. And there's a tubercle called quadrate tubercle. Very good. It gives insertion to quadratus femoris. Good. So please keep these points in mind. Okay. Okay, class, I think we can just leave the meeting right now and rejoin because it's about to stop in a few minutes. Okay, so I'll just stop the meeting and you can rejoin. Okay, just leave the meeting and rejoin. Otherwise, it'll get interrupted in between.